So one of the challenges we face in our Paediatric Oncology unit is the language barrier. Most of our children do not speak English, and most of our doctors do not speak ICCD. So it's really difficult to completely explain to parents and their children what's going to happen with them and how we're going to treat them. And our lives would be very, very difficult if it wasn't for our CHOC social worker. Our CHOC social worker helps us interpretation. She is great at putting the parents at ease. She really tries to break those language barriers. And we're forever thankful for CHOC for providing us with the social worker like
Long-term follow-up care for childhood cancer survivors may assist in the identification of complications after treatment and improving outcomes and quality of life. South Africa is currently developing a national long-term follow-up program. Some challenges in establishing and expanding such a service is the lack of healthcare staff, doctors, nurses, allied healthcare workers, experience in the provision of long-term follow-up care. Also, the lack of a national childhood cancer survivor database that's kept updated. Some challenges for the survivors include socioeconomic problems that may prevent them from adhering to such a program and not understanding the purpose and the importance of long-term follow-up care.
I am Prof. Unveiling from University Hospital in the Free State. Our problems regarding distance and treatment for children with cancer has influences many aspects, because at the local hospitals where the children get treated, they don't have the resources or people with skills to look after these children. So parents frequently end up in clinics where nurses and doctors actually don't identify warning signs of cancer diagnosis or signs of the child actually very sick. So the children can actually have severe and serious infections like septic shock and sepsis, and that get missed and just treated with oral antibiotics. So the poor patients, and because they don't have their transport, it's quite difficult they have to rely on the local hospital system to refer them to us. That's where the issues comes in, because we always ask them to go to there's limited resources and limited interventions and things that can be done at the local hospitals.
My name is Dr. Elirani Majia. I'm the pediatric oncologist at Dr. George Mukare Hospital. Our pediatric hematology and oncology unit caters for patients from the northern side of Pretoria, as well as patients from outside Pretoria. The bulk of the patients coming from outside Pretoria are from the northwest province, which means that some of these patients have to travel as far as 200 plus kilometers in order to come to receive their treatments. So over the years, we've experienced quite a few challenges, especially with the patients coming from far, in that we tend to lose them to follow-up, or they delay in coming back for treatment due to financial constraints, which actually has dire effects on their overall outcome. So what we have done to try and counteract this problem is that we keep these patients for long periods of time in the hospital, which at the end of the day, we actually end up being their main emotional supporters, as unfortunately our hospital does not have lodging facilities for the caregivers in order for them to help us with the additional invaluable emotional support that is required for this little one.
Hi, I'm Alan Davidson from the Red Cross War Memorial Children's Hospital in Cape Town, South Africa. Working in Southern Africa has its special challenges. As you know, we live in a diverse region with upper middle income countries like South Africa and Botswana, and also poorer countries where facilities for the care of children with cancer are very limited. We receive many calls for assistance and advice from both parents and pediatricians across the region. Although we cannot provide treatment to every family seeking help, we assist where we can and always provide appropriate advice and information via the treating team. This is very important because sadly parents are often not best placed to ask for medical advice. They may not have all the clinical facts at their disposal or access to all the laboratory or scan reports. For this reason, we strongly encourage families to seek help by asking their doctor to contact our team.
I am Dr. Beverly Nyetling. I am the head clinical unit of Nkosi Albert Lutuli Paediatric Hematology Oncology Unit in Durban, KwaZulu-Natal, South Africa. KwaZulu-Natal is a province with deep cultural and traditional beliefs. Hierarchy is also very important in this province. Patients will often seek the assistance of a traditional healer if they have a medical problem, rather than, as they put it, seek assistance from modern or Western medicine. This leads to late diagnosis, which leads to patients being diagnosed with advanced stage disease. Advanced stage disease leads to poorer outcomes. So how do we solve this problem? I have been working in this province for almost 25 years and have realized that you cannot change the beliefs of our people. Instead, find a solution by working together with the traditional healers, by communicating with them all the time, by education, and by embracing them as part of our medical team.
Good morning, I'm Geetha Naidu. I'm the head of Paediatric Oncology at Chris Hani Baragwanath Academic Hospital, and I'm also the head at the University of the Academic Head at the University of the Witwatersrand. In addition, I'm the chair of SAPA. Biggest challenges to early diagnosis for children with cancer in our country is the lack of awareness. Many of our children present with advanced disease. Many more don't even get diagnosed, as we see from our numbers in the South African Cancer Children's Tumor Registry. So I think we have a lack of awareness. People do not think about childhood cancer, in spite of us really trying to emphasize the teaching at an undergraduate and postgraduate level. And we have come up with the early warning signs, the Sensiluan early warning signs at Chris Hani Baragwanath Hospital, and we are very grateful to CHOC and the National Department of Health for disseminating these early warning signs. So when we looked at a study pre and post implementation of these signs, our numbers of referrals really gone up, but unfortunately this did not translate into early diagnosis. And for me, early diagnosis with swift referral to a treating center is key to improving overall survival of children and adolescents with cancer.
Good day, I'm Dr. Liesel du Plessis. I'm a pediatric oncologist for the Northern Cape province. I treat and look after children with cancer and serious blood disorders, and also teenagers. I think if we really want to know where the gaps are, we should probably turn to the patients and ask them what is it that they need. I think we should get as much information as possible from the community and from the people that we serve. Ideally, you want a child or a teenager that presents with certain warning signs at district and community level to have a swift path of referral to a specialized unit where an accurate cancer diagnosis can be made so that effective treatment can be started as soon as possible. That is a huge gap still in 2024 for many of our patients.
I'm David Reinders. I'm the head of Paediatric Oncology at Steve Biko Academic Hospital. Steve Biko caters for children with cancer throughout the northern part of Gauteng, all the way to the top of Mpumalanga. One of our greatest challenges and challenges for the family is the distance that have to be traveled to receive treatment. I'm sure you can imagine that any family that has a child that is being diagnosed with cancer in it faces huge emotional and financial burdens. And this is confounded by the fact that for children to receive treatment, they have to travel several hundreds of kilometers. This not only increases the emotional burden in that they are being separated from their families, but also a financial burden, as they are not often able to retain employment, or that they have to pay in extra just to travel that extra distance.
Hello, my name is Jennifer Giel. I'm a paediatric oncologist at Charlotte McCrae Johannesburg Academic Hospital. I'd like to talk to you a little bit about the WHO Global Initiative for Childhood Cancer, which is an effort to increase survival rates for children with cancer around the world to 60% or more, which will save at least 1 million children's lives by 2030. So where are we in South Africa? The truth is, we don't really know because we don't have great baseline data. We are still underdiagnosing many patients. They're not reaching specialist centres, and if they're not reaching those centres, they can't be cured. So a group of us are working very hard on increasing early diagnoses, getting those patients referred to specialist hospitals, and once they're in those specialist hospitals, making sure that they have access to the best possible care that we can provide. So we have some data to show that our survival rates are above 60% already in some centres, but we don't have any evidence to show that this is the case in the whole country. So this is why we're doing a lot of research and a lot of collaborative work to try and get these patients to the right place, make sure that they're getting the right treatment, and to give them as much support as they need so that they can carry on with treatment. And we do this with a lot of help from organisations such as CHOC, who make an enormous difference, and they're one of the reasons that we have a low treatment abandonment rate.
My name is Hedley Lewis, CEO of CHOC Childhood Cancer Foundation, South Africa. Today, International Childhood Cancer Day, is a day where we amplify, we unite, and we showcase the magnitude and numerous challenges that children, teenagers, and their families go through over and above the challenges of the treatment. Today, we unite with Childhood Cancer International, SIOP International, SIOP Africa, National Department of Health, our very own South African National Department of Health, SAPO, and various other organizations globally to ask, plead, and request for you to showcase the love and the care for these patients, to say that today we are putting children with childhood cancer needs and their thoughts in front of others. Today's the day of hope. International Childhood Cancer Day is yours and mine and our opportunity